mechanics of the opioid taper are easy, definitely not rocket science. But if the astronauts are not ready for the launch, the mission will not be successful. To prepare your patients for takeoff, remember, velocity and validation matter. First, the mechanics. The most important thing to remember when tapering patients off of chronic opioid therapy in the outpatient setting is to go slowly. Medical journals commonly cite decreasing by 10% of the original dose per week, but this is way too fast for many patients who have been on opioids long term. The brain needs time to adjust to a lower dose of opioids, and this adjustment can take months to years in some cases. Other important rules of thumb: let the patient be involved in deciding how much to decrease and when. Studies demonstrate that people can tolerate higher levels of pain when they have some say over how and when it is inflicted, compared with when another person inflicts the pain. It's okay to take breaks in the tapering process, especially if the patient has an important event coming up and doesn't want to be in low-grade withdrawal. Never go backwards. I tell patients, no matter how bad the withdrawal gets, don't go back up on the dose. If you do, you've lost all the hard work you put into adjusting to the lower dose. This clinical pearl comes from Heather Ashton, who has written a definitive work on how to taper off of benzodiazepines. Her maxim of never go backwards applies equally well to tapering off of opioids. A slow taper was crucial to Laura's ability to taper off of opioids. She was initially tapered from 120 morphine milligram equivalents daily to 90 morphine milligram equivalents daily as part of her acute psychiatric hospitalization. Opioid tapers can be done much more quickly in the hospital, but even so, the process was painful for Laura. She was discharged on methadone 15 milligrams daily and needed the next 2 years to get all the way off of opioids. You see how slow that is, and the last little bit is typically the hardest. The mechanics of the outpatient opioid taper are easy. Go slowly. Let the patient be involved in deciding on the pace. Take breaks and never go backwards. Now, how do we psychologically prepare our patients? That's where validation becomes so important. First, validate how scary the idea of tapering is for many chronic pain patients on long-term opioid therapy. Don't minimize their terror. Let them know that you know they're afraid. Next, prepare patients for what to expect, and don't sugarcoat it. These are patients who will feel invalidated if their experience is worse than their expectations, and pleasantly surprised if it's not.
I know how scary this is for you, but we're in this together, and I will support you through this journey. I'm not going to lie to you, though. This is going to be hard work. Opioid withdrawal can be very painful. Typical symptoms include vomiting, diarrhea, runny nose, goosebumps, and muscle spasms. It can feel a lot like having a bad case of the flu. In addition to physical symptoms, you will also likely experience anxiety, irritability, insomnia, and low mood. But most importantly, you're going to have more physical pain. Even people without chronic pain can get full body pain during opioid withdrawal. For you, it will likely be even worse since you have an underlying pain condition. What is really important for you to remember, though, is that the increased pain is not an indication of progression of your underlying pain condition, and not the pain you will have to live with off of opioids. It is opioid withdrawal-mediated pain. Indeed, we can be very hopeful that when you are all the way off of opioids, your pain will improve.
I don't know, doctor. That sounds so hard.
It will be hard, but we'll take it slowly, and I'll be there every step of the way. One way to think of it is a little bit like undergoing chemotherapy for cancer. I'm asking you to do a very difficult, very painful thing. At times, it may even feel unbearable. But when it's over, I'm very optimistic that you will be in a better place and feel much better than you do now.
Every time you reduce the dose, remind your patients that all the symptoms of opioid withdrawal will recur, but reassure them that tincture of time alone will improve their symptoms. Finally, Never be stingy with the bravos you give your patients every time they are able to go down on their dose. And give yourself a few bravos too for encouraging your patient toward wellness along a thorny and seldom trod path.